Now, let's call our next speaker. He's Mr. Mathivanan Sakthivel. Is the director for BreastScreen for both South East Sydney Local Health District and Illawarra Shoalhaven Local Health District. I used to work in Prince of Wales, so I know that South East Sydney local health area. He will tell us about what to expect during the BreastScreen journey and after the mammogram. And of course, he is also from Sri Lankan background, so he understands the cultural sensitivities and all those things, which of course he'll present. Thank you.
All right. Firstly, I want to thank everyone for coming to this event, and a special thanks for Dr. Yadu Singh for making this happen. For me and Nirmala, one of the main important job is to actually increase participation, and this event is going to help us increase the participation of the community which has got under screening. Now, I just wanted to expand more than what Nirmala has touched base about breast screening service, and also to expand what you saw in that DVD. Yeah, so my pledge is to say yes to the live screening mammogram. So that's my pledge. So when you go to a breast screen service, you will receive excellent service. The reason why you receive excellent service is, as Nirmala alluded to, we've got about 177 standards that we have to meet by BreastScreen Australia. So that goes from how the staff are performing, how much cancer we are detecting, within how many days we are actually bringing the women after screening for treatment, and so on. So it's a very comprehensive accreditation program, and that makes sure that we are actually providing excellent service at all times. And in terms of staffing, I just wanted to mention that they are competent and they are maintained competent as well. So the radiologists who are specially trained in breast screen reading, they go through a lot of performance indicators to make sure that they are actually doing a good job in terms of cancer detection, and also making sure that they're not recalling women for further tests if it's not necessary. And they are monitored on a 6-monthly, yearly basis. So they are competent and they are kept competent. And in terms of the radiography, people who are actually the X-ray technician who takes the X-rays, there are again standards to make sure that they are kept competent. We look at to make sure that the image that they are taking is of good quality, their positioning is good. So the quality is what stands out when you go to a breast screen service. And as Nirmala alluded before, we've got state-of-the-art digital technology, so all services in New South Wales, indeed in Australia, are fitted with the new digital mammo machines, which are better than the old analog technique. So that's again, helps to provide the excellent service, quality service. And I just want to touch base in terms of the service that we provide. Currently, I think there are about 42 fixed sites, and you can see the fixed breast screen sites in hospitals. You can see them in shopping centres. There are plenty of breast screen services in shopping centres in Western Sydney, especially, that Nirmala looks after. There's a breast screen service which is called Sunflower Clinic in Parramatta, in Castle Hill, in Blacktown. In addition to hospitals and shopping centres, there are also services which you can see in medical centres. And also mobile vans. The mobile van, there are about 13 of them in the state, which goes to various places. They go to nearly 160 locations, which covers metropolitan, regional, rural. So there's a big coverage. So there's no excuse for people to say, I can't get to a breast screen service, because the accessibility for breast screen service is great. So you can actually travel from wherever you are within, 20 to 30 minutes if you're in the metropolitan region to have a screening done. Now, one screening mammogram is done, as per the DVD that was shown earlier, most of the women will get good news to say that they don't have cancer. So the stat says to us 90 to 95% of the women will not have cancer. It's only the 5 to 10% of the women that we would actually get them to come back to do further tests. And I just wanted to show you what will happen when they come back. Now, that's a big peace of mind for people to have a breast screen done, rather than thinking to yourself, have I got cancer? Have I? There are a lot of myths about breast cancer as well, and I think Nirmala was very clear in terms of identifying the various risk factors for breast cancer. But there are a lot of myths. People get confused about various messages that goes out that you have to only check your breast. You don't have to have mammograms. But mammogram is the best technique to actually detect breast cancer, and it's needed to be done for most of the people every 2 years, which gives you peace of mind. Now, when a woman is recalled, we call it as recall or assessment. So various tests are done onto the women to see whether if we can actually find the cancer. So in terms of the reading, so the first mammogram, so usually they take about 4 to 6 images. So once those images are read by 2 radiologists, and if one of the radiologists says, you know, there's something abnormal, we have to get the women. If the other radiologist says, no, that's fine, we actually get a third radiologist to look at the images again. And whatever the third radiologist says then is accepted. And if any abnormality is found in the images seen, the woman is recalled for assessment. And as I said, only 5 to 10% of the women would be recalled for further assessment. And not everyone who recalled for assessment will get cancer. It's only a small percentage of the women who are recalled on that particular day may have cancer. Most of the women will not have cancer, or they might find something which is benign, which is not spreadable, which is not going to affect you. And during the recall process, any test taken, again, they are free. So you don't need to pay for anything. So I just wanted to track the journey when a woman comes in for recall. So when a woman first comes in for recall, she will meet with the reception staff, and then she will meet the counsellor. And the counsellor will go through the procedure in terms of what's going to happen on that day, and then she'll get consent for the various procedures that might happen. Then they will do another mammogram just to localize where the abnormality is. So that mammogram will be done by a radiographer who is female all the time. And the radiologist who's doing the assessment clinic will then review those images being taken, and then they will determine what further tests need to be taken. And again, not everyone will have all the tests that I'm going to be talking about today that they will be undertaking when they come in for recall. So it depends on a case-by-case basis. Ultrasound, that's a technique that's applied using sound waves. Again, they localize the abnormal area to see whether if they can see something through ultrasound. And there's also a surgeon who takes a part in the assessment clinic, and the surgeon does a clinical examination as well. So it's a multidisciplinary approach in the assessment clinic. And again, not every woman will undergo biopsy. Biopsy is a technique where a sample of sometimes a cell or a tissue is actually taken to test to see whether if it's a cancerous cell or not. Not everyone will have biopsy, and again, I think the percentage of people having biopsy in a particular clinic it's not a lot. So once a biopsy samples are sent to pathology, the pathologist reviews it, and the result is given to say whether if it's a cancer or not. And that result is then communicated to the women, and for most of the women, as I said, who attend the recall or assessment service will not have cancer, so they will be given a phone call to say that they don't have cancer and to come back in a year's time or 2-yearly time, depending on their situation. But for people who have got cancer, they will be asked to come back again, and the surgeon, the counsellor, and a few other people will talk to them to see what needs to be done. And they will actually help with the referral process for treatment, and they will also follow up once the referral is made as well to make sure you're actually having treatment. And with treatment, people can choose the hospitals or choose a doctor that they would like to have treatment with. The BreastScreen service ends at the time of diagnosis, but services such as Nirmala services extends beyond screening, where they take a part in treatment as well. So it's not again, with assessment, when a woman comes for assessment, they'll be staying in the assessment clinic for half a day to a day, so which is not a lot. And as people were saying, the best protection from cancer for your breast is breast screening. So it's important that people actually spread that message through your patients or through your families. It's free, and we're not sure why people are not taking that opportunity. We think that it's lack of awareness, and that's why these events will actually help us to actually increase the awareness amongst the community about breast screening. It's free, it's easy, and it gives you a peace of mind. So that's a message I want to give you all. Thank you.
Thank you, Matty. Information obviously needs to go to people who should use it. And just a comment. If we have a dance and song event, I can tell you there would be thousands of people going there. But when it comes to health, we sometimes don't give importance to that particular thing as much as we should. So now, that gave me an idea when you were talking, Matty. There are so many events we do, so many. I'm talking about Indian community. Literally, there are 3, 4 sometimes during one weekend. I pledge, part of the pledge, if I have one slide, only one slide, I can't get multiple slides like what Nirmala presented, but one slide, I'll get those organizers to present that when they promote the sponsors, I'll get that slide there as well, free of cost. I'm sure I can get that done because they will listen to me if I ask them, this is important. So if I can get one slide at a later stage, that slide will go to every event from my community at least to be presented as part of, they have a slide so far, sponsorships and all those things. We'll get that done. Now, obviously he mentioned that the women only are the workers at mammogram places. You don't get cancer from going for cancer screening. You don't. Breast cancer screening, a mammogram would not give you cancer. And closing the eye that, I don't want to know about this will not save you either. So those things are not obviously valid. And I think sometimes we do it, particularly the Indian background. If you don't think about it, hopefully you will not get it. That doesn't work that way. And one more thing, which I think we talked about in the leadership forum. Whatever God wishes is going to happen, why bother, why worry? This is a very big thing in at least Indian community, and I presume Sri Lankan community. Whatever is in my destiny is going to happen. Kismet. Kismet mein jo hai wahi hoga. No, you need to also work to make sure you are not getting into trouble. So Kismet is good, but you also have to work. God helps only those who help themselves. That's very important.